Okay, this video is for new viewers. It is, September 2025. If you've already watched videos on this channel, you know the channel, then don't watch this. You'll be bored out of your mind. This is all old stuff. But for people who are new to the channel, I just want you to realize what this channel's about. The goal of this channel is to be one of the best nutrition and health channels on the internet. It already is. My goal is to be the best doctor in the world. I already am. The other goal of this channel is to save Western civilization and Christianity because it's the only hope for mankind, okay? If you actually know what's going on in the world, basically there's a struggle between the billionaire perverts pushing communism versus Christianity trying to stabilize itself. That's what's happening in the real world in terms of things that matter. Okay, this site's just a hobby for me. I like doing it. I feel like it's something useful. I got to do something. It's a pretty intellectual site. I would say the average IQ level of the videos at this site is 120 to 140. So it's not for dummies. And I figure that way because, it's totally shadow banned. Only a pretty smart person is going to find this site. So that's just how it is. I do have a beginner playlist. Like I know everybody's got stupid friends and relatives. You can send them to the beginner playlist, and if they want, that's a little easier for people to handle. The best value on this channel is the playlists, and because they are in categories of like the common diseases and no repeats in there, at least no intentional repeats. As far as the healthiest diet in the world, we all know what it is. Anybody who studied it knows it's low fat, low sodium, 100% vegan, whole food, 100% organic, single ingredient only, no meats, no sweets, no oils, no alcohol, no MSG, no MFG, no caffeine, no MJ, no tobacco, no sweeteners, no flax, no soy, no omega-3s, no nuts, no seeds. Okay, that's the deal. All right, I explain why in plenty of my other videos. I've been around a long time. Despite the fact I look quite young, I'm actually 62 years old. I have read all through Kempner, through McDougall, through Pritikin. Okay, I know where the real health comes from. I've seen all the lectures from Jeff Nelson. I've seen tons and tons of nutritional information, okay? So I'm trying to help you. There it is. Take it or leave it. 19 out of 20 patients are too stupid to see what a good deal it is. The fact that it can prevent or cure pretty much almost all the common chronic diseases most of the time. Okay, what else is on this site? We go into a lot of advanced pathophysiology. I figured out the best theory to explain dementia, to explain back pain, to explain the role of mitochondrial inhibitors in disease, including cancer, fatigue, and all that. We do a lot of academic stuff here, especially like study skills, how to give presentations, how to write better, a lot of art and culture stuff. I love paintings and a lot of other related stuff. Book reviews, best Christian music, all of that's on here. My father's from Ireland, so I like Irish history. My mother's from Puerto Rico. I like a lot of Spanish stuff. This is a lot of times I'll have videos about something related to Christianity. I love Christianity. Okay. I know the shorts kind of stink, but I don't make them. One of the viewers makes them. I don't even know how to make them, but people like them, okay? As stupid as they are, I know my smarter fans find them a little bit stupid and vulgar. I do too, but a lot of people watch them. Far more people watch those stupid shorts than watch my regular long-form videos. You don't need to ask me if I want to debate somebody from another channel who disagrees with me. If they disagree with me, then I think they're wrong, okay? I don't really care about debating them. I'm much more interested in studying new and advanced disease. Whenever I'm making these videos, I'm typically reading one of my recent books, but in my free time, I'm studying new stuff, okay? I'm not that interested in wallowing in the gutter with some, low IQ, paleo, keto, carnivore, phony scumbag. Okay, so anyways, I hope you find this channel helpful. I'll try to answer questions. I answer some of them, when I can. I don't got a lot of time. I work full-time as a clinical MD, so I barely look at them for about, 5-10 minutes in the morning, another, 5-10 minutes in the evening. If I get a little free time here or there, I'll look at them some more, but I don't get that much time to go through the comments. You can send me an email. One thing I tell you, if you're going to write a comment, don't sit there and tell me about you having a medical problem and wanting me to be your doctor. I cannot be your doctor. I am not your doctor. I don't do telehealth, okay? I can answer, a general medical question. This site is for educational purposes only. I am not your doctor. These are just educational videos. My books are just for educational purposes. I don't do telehealth. I do not see consultations in this manner. So it's just helpful information. So anyways, hope you find the site helpful. There's thousands and thousands of videos here.